Welcome to How We Did It, a podcast dedicated to dentists teaching dentists. This podcast is powered by eAssist Dental Solutions, the nation's leading platform for outsourced dental billing and other services. All of the guests are winners of eAssist's Top Practice Award, who share their experiences, best practices, and what sets them apart in their communities. Their opinions and recommendations are their own, and you should consult with your own professional advisors with respect to your own practice. Welcome to today's episode of our How We Did It podcast, a podcast dedicated to dentists teaching dentists, featuring our Top Practice Award winners. I am thrilled to introduce Vivid Smile Chicago. Thank you for carving out some time in the beginning of the week to spend with me. I'm so excited to have you here.
Thank you.
Thanks for having us.
Of course. So we can jump right into the questions. First, I'd love to know a little bit more about both of you, your practice, and your journey in dentistry.
Yeah, so I'm Christine Ciullo, one of the co-owners and dentists. So a little bit of background, this kind of goes for both of us. We both attended Case Western Reserve University School of Dental Medicine in Cleveland, Ohio. We were not in the same class. We actually didn't really even know each other during school. We were a couple years apart. And then both ended up in Chicago and coincidentally working at the same practice. So it was kind of then that we realized that we had gone to the same school, knew a lot of the same people, and just kind of working together over time. We both kind of knew that our goals aligned in terms of how we practice dentistry, as well as wanting to become owners of a practice. So basically starting around this time last year, we began speaking with the owner of the practice we were both working at and discussing a buyout, and we completed that back in September. So we've been practicing as Vivid Smile Chicago for about 7 months now.
Awesome. Congratulations. That's so exciting.
Thanks.
Yeah. So I'm sure Chicago, there are many practicing dentists. How does your practice differentiate yourself from other practices? And then what does your community involvement look like?
Sure.
So I would say, around the time that we started, creating our website, we were talking about these things, like what differentiates us from the offices in the area? Because, like you said, there's a ton of dental offices in Chicago. Just in this block alone, there's about 4 of them. So discussing it, we decided that probably the main thing we wanted to emphasize was transparency with our patients and educating our patients. Those are the 2 biggest things. And it's one of the reasons that when we started, one of the first things we did was buy an intraoral scanner to kind of help with that. So we're really big on being able to not just treatment plan and, let our patients know, hey, this is what you need. Okay, bye. Let's get you scheduled. It's more so about, taking photos, showing the x-rays, explaining the process, trying to educate them so that they're aware of why they need to get what they need done. And I find that also fosters a lot of trust in our patients, because the type of patients that we see are all young professionals. So they're educated, when they ask questions, they want to know why we're doing what we're doing. And it's not, they don't ask it in a way to, come off as, like they're questioning your authority. They're asking because they want to understand. And I agree with that. I'm the same way. So, just fostering communication and transparency with our patients and educating them.
Yeah. And also just providing like top quality dental care efficiently. And, making sure that we're also keeping in mind overall health and wellness, because your mouth has such a huge effect on your overall being and your well-being, and educating the patients in that direction as well is really important to us, so that they understand, like, if you've got diabetes, here's some things that can, that correlate back to the oral health that can either help or hurt that disease, and why that's so important.
Yeah, that's awesome. I love how you touched on kind of building those patient relationships and fostering trust there. I think it's so easy, speaking from a recent experience in a hospital setting, it's so easy to feel like you're another chart or another number or just a patient on the doctor's docket. And there's a really unique opportunity in dentistry that sounds like you're taking full advantage of.
Right. And I would totally agree with that. It's kind of a lost art to healthcare, I think, that, one-on-one attention to your patients and really knowing your patients. I mean, I agree. My sister just went through something, and we were just discussing how impersonal the care is with a physician. And I'm glad that, dentistry hasn't really gone that way yet, and that we can be big proponents of continuing to have really good relationships with patients and that open wavelength of communication so that, they know we care, basically.
And being able to have the time to build that rapport is so important. Now, having come from a background where, I thought at one point I was working at a DSO and you really didn't have a lot of time with your patients. It was very much, and I can understand from their perspective feeling like you're just another number. And I don't like having, I don't like that as much as they don't like being treated like that. So being able to have the time to build that rapport is huge. And a lot of the patients that we see, it's from word of mouth. So
that's awesome. Sweet. So obviously we're partnered through eAssist, and we are honoring your practice as a top practice. And this somewhat ties in with differentiating yourself from other practices, but could you speak a little bit to what a top practice means to you? Or when you think about a top practice within the dental industry, what do you think of?
Right. I think it does go back to that, the question about differentiating yourself. It's executing those things that you think are lacking in the field overall, or just not a super strong suit of all practices. And it's finding those little things and nuances and putting them into action at our practice, and really honing in on those things, and also listening to patients, because, you might, as a dentist, sometimes you forget what patients know and what they don't know, and what they want to hear and be educated on. We don't want to drone on about some stupid procedure that nobody cares about. They want to talk more about what are the overall, effects of this. So really listening to our patients and getting their input and collaborating together so that we're, while we're treating disease, we're also treating, for aesthetics and things like that, and patient preference. So we have to take that into account as well. So I think keeping those things at the forefront of our practice kind of is what being a top practice award.
I think also,
winner.
The other side of things is having a good staff, having a seamless, efficient, day-to-day activities, having the right staff to surround yourself with. We struggled with that in the very beginning, trying to find the right people. And it's not just us. I've spoken with some of my peers, and everybody's having a really difficult time hiring at this time. So, we went through the whole not having the right person. We realized how difficult it was. And now we're finally at a place where we're so happy with the people that we work with. It's not just like an employer-employee type of relationship. Everybody, gets along really well. Everybody's, doing what they need to be doing. I think that is a big part of seeing success and as a top practice. So other than,
Yeah, that's great. I know on our end at eAssist, we hear a lot about the staffing shortages, and sometimes that can be initially what draws people to us.
Yeah.
I think this is a perfect segue into our next question. Could you speak a little bit about your experience of what initially brought you to eAssist and how having eAssist has impacted your practice?
So just to continue from what she was saying, that's exactly how we started a practice, and there is a shortage in employees out there. But also, as a dentist, we aren't trained very well in how to run and manage a practice. So it's a lot of learning as you go, learning on the fly and integrating it. And so in the very beginning, we had to choose what things we could focus our energy on in addition to being providing care. And when we learned of eAssist, it was a great solution to kind of the insurance end of things. Took one very major component of running a practice off our laps and into very capable hands. And that made things a little smoother, a little easier, especially while we struggled to find proper front desk personnel and things like that. So it was very important, and it's been wonderful to have that and kind of not have to worry a lot about that aspect of things.
It is a very tedious aspect of ownership, is insurance collections and follow-up and all that. So it does take a lot of manpower. It does take a lot of time. And we realized pretty quickly that even if we were to find the right front desk, someone who's capable of doing that, I almost would rather them focus their efforts on scheduling and bringing patients into the office and all the other aspects so that, eAssist can just take care of what they need to take care of. And it's just a great, it's a great balance that we've achieved.
Yeah, that's great. Thank you for sharing that. I know one of our primary goals is to take that process off of providers' hands or offices' hands so that they can spend more time with their patients and delivering that patient care. Awesome. Well, this brings us to our last question, and I'm very curious to know your answer. It sounds like your background at Case Western played a little bit in your role of coming together. So if you were in a conversation with a provider who was fresh out of dental school, maybe they're interested in opening their own practice or pursuing a different route, just a generic conversation, and they were seeking your advice, what advice would you give them?
Honestly, and I can only really speak for myself, and Christine, feel free to jump in whenever, but I find that especially nowadays, when you graduate school, you are so fixated on the dollar amount of what you owe. I mean, you spent 4 years racking up all this debt, and everybody knows dental school is not cheap by any means. So you tend to fixate so much on the money aspect, trying to make money and this and that. I would probably advise a new graduate to kind of take a step back. Try not to focus on the money. The money will come. Rather, try to find a office that can, somewhere where you don't have to compromise your ethics, essentially.
And your values.
And your values. And find somewhere where you can find the mentorship that will allow you to ultimately reach those goals, because there are so many more important things than money. And the money will eventually come. You just need to be patient about it and just really focus on building your skills and your ethics and, working in an environment where you can foster those relationships that we talked about earlier, and building that rapport and focusing on all that, because when you're working in a high volume environment, you really don't have the time to develop those social skills that you develop with patients. You just don't. And so I think you lose a lot of that. And then when you do that for a couple of years and then you switch over to a private practice model, that disconnect is very obvious and patients can feel it. So
yeah. And just to remember, keep in mind why you went into the field to begin with, because most of us did this to help care for others and provide healthcare. And basically overall health and wellness is at the forefront of why we do this. Yeah. So just keep that in mind and don't let the other things kind of cloud your judgment in pursuing certain jobs.
Yeah.
That's awesome. Thank you. I think that advice will really resonate well with our audience. I think a lot of times, like you said, it's easy to kind of get it backwards and be going after the money first and then focusing on the relationship side, kind of putting the cart before the horse. So
exactly.
We're all there. So we get it.
Right.
We totally understand.
Sure. Yeah. Awesome. Well, that concludes all of my questions. It was great having you on the podcast. I really enjoyed our conversation, and congratulations on that top practice award.
All right. Thank you so much for having us.
This podcast is sponsored by eAssist Dental Solutions, a platform dedicated to helping dentists get paid faster and get paid more. Dental insurance billing services provided through the eAssist platform can relieve your dental insurance headaches, get your over 90 insurance receivables near zero, and help you collect 100% of what you are rightfully owed by insurance companies. To learn more about how the eAssist platform can help your practice or to schedule a free consultation, please visit dentalbilling.com.